Hello, everyone, and thank you for joining the Zoonotic TB webinar, which is sponsored by the union. We're very happy at the number of people who have registered for this event. My name is James Sundstrom. I'm a tuberculosis physician in Michigan in the United States, and we were going to have two speakers today. Dr. Francisco Olea-Popelka, who is a veterinarian at Western University in London, Ontario. He has a long career working with zoonotic tuberculosis. And we will have Dr. Paula Fujiwara, who has a long career working with human tuberculosis and was also the former scientific director for tuberculosis at the Union. So I'm just going to give a little brief recap. The first zoonotic webinar in this series was last month, and it was quite a unique session because it involved the personal stories of two young women who both had recovered from serious illness due to Mycobacterium bovis. These women had actually met at a tuberculosis survivors group and were somewhat surprised to find out they both had M. bovis disease in the previous years. Adriana on the lower left is someone I know from Michigan, and she presented her dramatic story of a prolonged time to making her diagnosis of TB, and then prolonged illness with multiple hospitalizations and medication side effects. And her potential source of exposure was to wildlife. Lisbeth presented her different but very complex story, which actually involved her being diagnosed with meningitis due to bovine tuberculosis. And both were really remarkable stories. I think these can go a long, long ways to raising people's awareness of this situation and how it needs to have more attention. Now, their presentations raised many questions that remain unanswered. And if we listen to those webinars, and those recordings are still available if you would like to listen to them, first and foremost, making the diagnosis of zoonotic TB was challenging and also very confusing for the doctors taking care of the patients, since this is such an unknown subject. There were unanswered questions in terms of how zoonotic tuberculosis was transmitted to these two women, but we think that Adriana from Michigan was probably infected after handling food being provided to a deer in an area where deer have bovine tuberculosis, which is endemic, and so we think she was exposed that way. On the other hand, Lisbeth, who is from Central America, could potentially have ingested unpasteurized dairy products because there is not complete veterinary control of bovine tuberculosis in Central America and also in many other parts of the world. But the transmission of zoonotic TB still remains a subject of considerable discussion and arguments, and certainly a lot more work needs to be done on the different modes of transmission. Both of these patients require complex treatment, and there are no published guidelines on treatment of zoonotic TB. Mycobacterium bovis is intrinsically resistant to one of our first-line drugs called pyrazinamide, and so immediately the treatment is going to be prolonged because of the lack of that drug. How one prevents zoonotic TB is something that we'll hear about in many webinars going forward, whether this involves how humans deal with cattle, how we deal with dairy products, how we deal with pasteurization of dairy products. And what makes it very challenging is how humans deal with wildlife that could be infected, a subject that requires quite a bit more attention. Finally, the overall global burden of zoonotic TB remains poorly documented. We have very rough estimates, and we desperately need more information based on modern molecular technology to really pinpoint what the overall burden is. But many of us who work in this area feel that it is more than just a rare or exotic kind of situation in some parts of the world. The union has participated in this diagram, which shows human interaction with cattle and wildlife, and there are arrows going in different directions. Actually, these arrows may go in two directions, and there are probably question marks at every level. I did want to point out at the bottom of this slide, there are 4 organizations that are participating on a global basis: the Tuberculosis Union on the lower right, FAO, the Food and Agriculture Organization, the World Organization for Animal Health, and the World Health Organization. This is called the quadripartite, which you may hear referred to on occasion. These 4 different organizations working together to deal with the situation. So just before the presentations start, there is an announcement from the union that at the union conference, which will be in Copenhagen in November, there will be an annual zoonotic TB section meeting. This will be broadcast on the internet, and it's open for anyone, even if they're not a member of the union. Links for this session will be emailed to you closer to that date in November. Our next ZTB webinar will be in January 26th, January 2026, and stay tuned for those notices. So I'm going to stop sharing my screen and turn the presentation over to I think it's Dr. Francisco. Are you speaking next, Francisco?
That's correct. I will share my presentation. Thank you very much, Jim. Let me see. Can you see my screen now, everyone?
Yes, I can see your screen.
Can you see it clearly, Paula?
Yes.
Good.
Yes.
Okay, so thank you very much, Jim. Good morning, everyone. Dr. Paula Fujiwara will start with the first presentation. Thank you.
Well, thank you very much, everyone, for joining us today. And as Dr. Olea-Popelka said, this will be a 2-part presentation. We'll flow one to the other. I'll start out, and we'll go from there. Next slide. So let's talk about that zoonotic TB roadmap. How did we get there? And it was a long and winding road map. And I'll explain to you how we got part of the global TB agenda. Next slide. So this is the outline of what we're going to speak about. We're going to start with the global goal to end tuberculosis by 2030. I'll explain the why we talk about it in that way, and then putting tuberculosis, zoonotic tuberculosis, on that agenda. Then Francisco Olea-Popelka will be talking about some of the roadmap milestones that we've accomplished from 2025 when we published this, was in 2017. But the big issue for us, for both of us as we work in this field, is, has this made a difference? And so what? And what we found that in the last 10 years or so, that the increasing role, the importance of community. Then we'll end with a discussion, a Q&A, about 20 minutes. We're only going to speak for about 20 minutes to give you plenty of time for questions. And I think that we need to think about this and the concept of being aware of what the problem is, accepting that there has to be something to do resulting in action. Next slide. I think that we were very fortunate at this time, about 10 years ago. There are many opportunities which I'll describe actually align. So here we see the planets are aligning, the stars were shining, many things were going on simultaneously. Next slide. So let's start with what was going on in 2014. Why is 2014 important? We were then doing the Millennium Development Goals, and they were due to end in 2015. So in May of 2014, at the World Health Assembly, where all the world's health ministers gather, the TB program said, we are going to change the way we do tuberculosis. And so they presented at the World Health Assembly this proposal, the Global Strategy and Targets for Tuberculosis, for after 2015. And that resulted in, next slide, the NTB strategy. It used to be called the DOT strategy, but it then became, and has since then become, the NTB strategy. Next slide. Now, as I said, the MDGs, the Millennium Development Goals, were ending in 2015, and the SDGs, the Sustainable Development Goals, were coming into play. The Sustainable Development Goals, there are 17 of them, and only one of them has to do with health, and that is goal number 3. Goal number 3 has 13 targets, and we can see here, I've highlighted it in yellow, that only 3 diseases are mentioned, and that is HIV, tuberculosis, and malaria. So it showed again in that time period the heightened awareness that tuberculosis was a problem. Next slide. There was also an awareness at that time that there were actually certain people, certain communities that were at risk. So you can see in the upper left-hand corner, here is a zoonotic TB survivor. Her name is Timpian Laseni. She has gone on to develop a community organization dealing with tuberculosis. And the reason she did that was that she was someone who had abdominal TB, and probably this was because of her ingestion, as she says, of the cultural tradition. She's from the Maasai community of drinking unpasteurized milk. So as was pointed out by Dr. Sundstrom, she went through a very arduous situation where they didn't know what the diagnosis was, and finally was diagnosed with the abdominal tuberculosis, because many of the techniques that they could use to diagnose an extrapulmonary TB were not available to her. In the bottom left, we also have people who are working in the butchers, the people that are actually selling the meat. And you can see a picture here of a nice piece of raw meat, and inside are tubercle bacilli, the actual tubercles. And this is actually a delicacy in Nigeria. It's called fuku eligusi. And this is something that people actually seek out to eat. So again, another risk. On the right-hand side, we have the whole issue of occupational risk. On the upper right, we have a veterinarian from the UK who went to work in South Africa, and in doing some of the field work became infected with M. bovis. And on the bottom, a very key place where zoonotic tuberculosis can be transmitted is in the post-mortem surveillance done by veterinarians who stand there 8 hours a day or maybe longer and actually slice into the lungs, slice into the livers, looking for organisms that for the tubercles that are tuberculosis. Next slide. The other thing that was aligning at that time was the Global Plan to End Tuberculosis. This is a series of plans to end tuberculosis that are published every 5 years. And in 2016 to 2020, and I was the chair of that writing committee, they said we need to have what they called a paradigm shift. And what was different is, as the chair of the writing committee, I had certain privileges. Next slide. And so we were able to get zoonotic TB into a key population at risk, in addition to people with HIV, people suffering from diabetes, people smoking, undernutrition. So this is the first time that zoonotic TB was recognized as a health threat. And people said, well, there are only a few people with zoonotic TB. The problem was that we didn't have the good surveillance. So at that time, it was about 100,000 people a year, but we were 10 years out from 2030. So, you do the math, it's about 1 million people with zoonotic tuberculosis, which is quite significant. Next slide. So why didn't it receive much attention? And it's just the point that I just made. We don't know what the true impact of, we didn't know what its true impact was, because we don't have, and we still don't have today, systematic surveillance for M. bovis as the causal agent. And this is especially true in the low-income, high TB burden countries where we have a lot of bovine tuberculosis. And also the lab tests that we use to diagnose human TB can't differentiate between bovis and Mycobacterium tuberculosis. Next slide. So we have to address, if you're going to address zoonotic tuberculosis, you have to address it in the source. There are many sources in animals, but the main one that pertain to humans is really in cattle. There's a lot of work going on the veterinary side, and we'll get to that when Dr. Olea-Popelka speaks. But you can see here some lab tests, whole genome sequences is coming to play. But some of these resources are not available in the countries that need them the most. Next slide. So at that time, Dr. Olea-Popelka was the chair of the zoonotic subsection. I was the director, scientific director in charge of zoonotic tuberculosis issues as one of my tasks. And we said to ourselves, we got to write a paper. And being the academics that he is and the programmatic person that I am, and I said, no, Francisco, we really need to bring in a lot of people. So we were able to publish this again. Everything's aligning in the Lancet in September of 2016. And we said, zoonotic tuberculosis is caused by M. bovis. And the most important thing, next slide, is that it was a call for action. Because we believe that it's not just saying something, but actually doing something. So next slide. So that meant partnering. All those authors that you saw there, some of them they're listed here, and we expanded that role. We had governmental agencies like the U.S. Department of Agriculture, the Animal and Plant Agency of the U.K. We had academics at some universities in some of the key countries, the World Health Organization, the OIE, now called the World Organization for Animal Health, and the Food and Agriculture of the United Nations, and the Stop TB Partnership, which was the advocacy arm. We got together in April. These dates are very important because, again, it's this clustering of events that are happening around the same time. And we came together in a group and said, we need to really galvanize the whole issue of zoonotic tuberculosis. And we had a goal. And that goal was, next slide, to address zoonotic tuberculosis. And we wanted to get approval by WHO just 2 months later on the prevention, diagnosis, and treatment of challenges faced by persons with zoonotic tuberculosis. Next slide. And we made it. So at the STAG meeting, the Strategic Technical Advisory Group meeting of the WHO, where all of the technical issues are decided, in June of 2016, zoonotic TB came onto the agenda. Next slide. And WHO said, this is a priority, and this is a priority for action, and we want you to create a roadmap. So a small group of us, led by Anna Dean at the WHO, worked over the next year, and next slide, we actually developed the roadmap that you all have seen and we're going to be talking more about it. We published it in English, in Spanish, in French, those being the official languages of the Union. And then what happened from there is, this was 2017, it's now 2025. What has been the progress? So I'll turn it over to Dr. Olea-Popelka. Thank you.
Thank you very much, Dr. Fujiwara, and thank you to the Union for the invitation to be part of this presentation. So what I will do right now, following Dr. Fujiwara, is to highlight some important developments. Of course, in the interest of time, I cannot go over everything. And I will discuss the remaining challenge, the main challenge or challenges with zoonotic tuberculosis, what I call the big elephant in the room. And really my presentation is not intended to be a lecture, rather a presentation to trigger, even to provoke a conversation with the audience. That's the purpose of today's webinar. Our purpose is to hear your comments, your ideas, your concerns, your thoughts about the current status of zoonotic TB. So the roadmap, when you look at the roadmap, the priorities or the core aspects of the roadmap can be divided in 3 pillars: improve the scientific evidence, reduce transmission at the animal-human interface, and strengthen intersectoral collaboration approaches. And for that, there was a clear time, short-term and medium-term milestones to be accomplished by the year 2025. Reason why we are discussing this right now, that as you can see, when it comes to the scientific evidence, it was focusing on new diagnostic tests to differentiate zoonotic TB, as well as having appropriate drug regimes and vaccine coverage for humans. When it comes to the animal-human interface, It was also important to develop new and better diagnostic tests for livestock and control the disease basically at the animal level. And at the intersectoral approach, the idea was to implement the One Health approach to tackle these challenges in a multisectoral, interdisciplinary fashion. So some of the important development, as I say, some, and my apologies if I don't include everything. Hopefully this will come part of the conversation. Immediately following the publication of the roadmap, the WHO, for the first time ever in the global TB report, they included zoonotic tuberculosis due to M. bovis. They did a very elaborate mathematical modeling, and they have some estimates for the first time, global estimates and regional estimates, in which they estimated, of course, with a very big uncertainty interval, that approximately 147,000 new cases per year were due to zoonotic TB. What is important, there was an understanding at that time, due to what Dr. Fujiwara already mentioned, the lack of systematic surveillance and appropriate tools to identify Mycobacterium bovis in humans. It was understood that this estimate of approximately 147,000 people a year was just the tip of the iceberg due to the lack of systematic and routine surveillance in low middle income countries where the disease is present on the animal population. Since 2017, there has been literally hundreds, and I say hundreds of papers, scientific papers on the subject. Here is just some example of them. And the Zoonotic Tuberculosis Network also was created in the year 2020, 2021, officially launched. And in there we have summarized, upload these papers, and you can find them there. Okay, also, you can find them in PubMed, Scopus, or any search engine. But there are literally hundreds of scientific papers on different topics, aspects of zoonotic tuberculosis, from molecular studies to case studies, systematic reviews, One Health approaches, etc. The Zoonotic Tuberculosis Network also has been highlighting stories, news, events, conference, and experiences of people that have been affected for this by this disease. In addition to this, and in the academic realm, books have been published, the bovine tuberculosis book and the essential tuberculosis book, in which a cross-pollination between human and veterinary medicine has been accomplished there, highlighting the importance of this topic both for veterinarians and for physicians. The European Union has been continuing updating and describing the reporting, I want to say, the number of human cases in the EU affected by Mycobacterium bovis and Mycobacterium capreae. Recently, the United Kingdom Health Security Agency, actually a month ago, they published these two reports, zoonotic tuberculosis transmission from animals to humans and zoonotic tuberculosis transmission between humans, two systematic reviews, and basically they are available online, and basically they conclude that the evidence in these studies was rated as very low certainty for same reasons that Dr. Sandstrom and Dr. Fujiwara already mentioned, and I highlighted in my previous slides. Similarly, the WHO, with colleagues in Australia and Nigeria, they conducted the systematic review in the Western Pacific and Southeast Asia regions of the World Health Organization. And they reported there some the cases that they found of human TB due to zoonotic transmission, and they also conclude that there is the data they study suggests a significant underreporting of zoonotic TB. Another important development is that since the year 2019, publications start appear on Mycobacterium oryges, especially in the India, Pakistan region. And this is an important development, and there are plenty of publications suggesting that zoonotic TB or requesting that zoonotic TB should be beyond Mycobacterium bovis and to include other members of the Mycobacterium tuberculosis complex. In January 2025, this year, we were asked, many colleagues around the world, to provide expert opinion to the WHO on this zoonotic TB study that they are conducting, again, to further emphasize the need to acquire more data or knowledge on this disease globally. But of course, it's important not to forget that when addressing zoonotic tuberculosis at the human side, we cannot forget, and actually we need to prioritize controlling the disease at the animal level, the source of the disease. So that's where the OIE, or the now called World Organization for Animal Health, WOAH, developed new guidelines for the control of Mycobacterium tuberculosis complex in livestock that were published a year ago. These guidelines were specifically done due to the fact that the test and slaughter is not feasible. The test and slaughter approach is not feasible in most parts of the world, especially low middle income countries, and these guidelines therefore were developed. In these guidelines, most of the current available scientific literature has been included. And for example, here, the topic of diagnostic test have been covered, and the development of DIVA tests that are able to differentiate between infected and vaccinated animals was prominent. There has been significant developments in this area, and this also is complemented with developments in the domain of differentiating M. bovis and MTB in humans. There are available tests. Some of them are in validation process, but there are good developments there. Also, the new guidelines, the WOAH guidelines, cover the topic of controlling, minimizing the risk of the disease transmission between animals, within herds, and between regions. And there is clear guidelines there for farmers, countries, or regions to deal with that. And of course, the topic of vaccines, BCG vaccine for livestock, have been very, very present in the scientific community. And as a matter of fact, there has been some important publications in the last year of field studies, one in Ethiopia. And there is currently a big study being conducted in Mexico, field studies, because it's very important, in addition to all the experiments done with vaccines, BCG vaccine for cattle, livestock, is very important also to test this and evaluate the efficacy of the vaccine under natural conditions. And there are great development going on in that field as well. Of course, the WOAH guidelines do cover the aspect of zoonotic transmission to humans. And of course, the issue of food safety and the issue of the challenge still remaining to differentiate on a routine basis in low middle income countries MTB from M. bovis and other MTBC species still remains and is addressed in this new document. And in addition to all these and many other developments, there has been plenty of conferences. The M. bovis conference, the WOAH has conducted conferences and webinars lately. The union, of course, have their annual conference where the topic is covered. And there are many other scientific and academic or medical platforms and websites in which this type of information has been produced and shared. However, we, with Dr. Fujiwara, when organizing this seminar, we thought about, so what? And as I say, I just mentioned some. There are many more developments, many more, but we don't have time to go over them, and that's not the purpose of this webinar. The purpose of this webinar is to talk about the elephant in the room. So what is the big elephant in the room? Is that despite all the knowledge, progress, and developments on zoonotic TB and bovine TB, this remains, especially in low middle income countries, a neglected disease in which most of the low middle income countries do not have official, well-established bovine TB control programs. And that, as Dr. Samstrom and the union clearly highlighted a month ago, results on people still suffering catastrophic and dramatic experiences when they get this disease. That happened a month ago with the union, and actually a few weeks ago in the Latin Americas, there was another webinar with a colleague, Dr. Edith Bernabé, and a patient presenting their experiences that are truly catastrophic for the people that suffer from this disease. So we have tremendous progress, but people and farmers still keep suffering considerably from this disease. So that's why Dr. Paula Fujiwara was emphasizing, and we think that the progress is great, but it's not sufficient. It's great, but not sufficient. And we need to emphasize now the involvement of the community, the affected, vulnerable, or more at-risk communities with so-called bottom-up approach. And in that regard, some good news, great news for the Latin American region is the involvement, the recent involvement of this organization, a coalition against TB called Activistas, led by Alberto Colorado, and they have been doing tremendous efforts, already successful, bringing physicians, patients, and scientists, and veterinarians, and medical doctors that are actually seeing these zoonotic TB patients, and now they're writing an article to update the situation in the Americas. So with that, I want to finish saying that there has been progress, and to tackle the main challenge or challenges of zoonotic TB that we still face today, despite the progress since 2017, is that we indeed need a One Health coordinated, comprehensive, multi-sectoral and interdisciplinary approach in which certainly healthcare workers and people in academia, scientists, you may think that you are in the center. I don't think so, but I put them in the center here because I know many of you are. But really, we need to involve other stakeholders. And among those stakeholders, I think personally that the affected communities and the policymakers, the decision makers, are key to bring into the conversation. So to finish up, I like to use one of my favorite sentences, that to address the challenges posed by zoonotic TB, science is absolutely necessary, and I am a scientist, but I fully understand that it's not sufficient. And we need this collaborative approach to address the 3 A's, to increase awareness, to achieve acceptance, and accomplish action. Thank you very much. I will stop sharing my screen, and Dr. Sampson, I hope this little presentation trigger now important discussion, and we would like to hear what the audience have to say. Thank you very much.
Well, thank you, both of you, for that orientation to this subject. I did want to let the audience know that on the screen you will also see Liliana Salvador, who is in Arizona working on bovine tuberculosis, and Hind Azami, who's a veterinarian at University of Georgia. And they're available for comments. Francisco, you mentioned One Health, and One Health is a very nice idea to have veterinary world and human health and animal health work together, but it's not as easy as it sounds. I should give you a little sideline that for myself and Dr. Azami, we're both in Atlanta, Georgia, at the largest infectious disease conference in North America called ID Week. And it's full of discussions about antibiotics and microorganisms and bacteria and viruses and fungus, but there is unfortunately no One Health session of any kind to be found. I think Dr. Azami is the only veterinarian registered amongst 5,000 people here, and I think that we need to really work on the human health side to get One Health sessions and make this a fixed part of our environment, rather than just being viewed as exotic, extraneous problems. So how do you think we should get One Health much more integrated into human health programs?
Well, I work in a medical school, as you know, Jim, and I am a veterinarian, so I know very well the challenges with the medical community. It needs to come with the 3 A's. It's going to be a long process to achieve change, and it's a cultural shift. It's a mindset shift. And I think that the events of the world today, at every level, are requesting from this change. So it will require to keep pushing activities like this, bring real life examples. We are not short of it, for the need of a paradigm shift. As I say, my presentation is meant to highlight tremendous progress, But if there is a criticism, it's not a criticism to anyone specifically. This is a strong criticism to the current status quo of health systems, of health organizations that are still working in silos, largely. Thank you.
And Paula, you want to make any comments about that?
I think what Dr. Olea-Popelka said is absolutely crucial. And I am a living example of how a physician, this has been traditionally One Health has been very much talked about on the veterinary side, but on the, as
Right.
pointed out, the human side, it's not been done. But I like to say I had a vision. I was listening to a Zoonotic TV presentation, and I saw in my mind, having worked many years in Africa, that if you kill someone's cow, then that person loses his livelihood. And for me, it was the economic issues that really propelled me to become interested in zoonotic TB. So I really feel that we definitely have to do a better job to get more physicians involved. And like Hin, when she was at this meeting and she's the only veterinarian, I have been at meetings where I'm the only medical doctor. So it goes both ways.
I think, Jill, there are some people that would like to unmute and comment.
Sure. So if someone wants to unmute their microphone and ask a question, please feel free. Now, in the chat box,
Tyler
is there anyone coming up?
Sorry, Jim. Tyler just mentioned that if anyone is interested in asking a question, they can raise their hand, and then at the time he will activate the microphone. It is just to avoid any unnecessary background noises. Thank you.
So please raise your hand if you'd like to say something. Okay. Can we let Vitor Salvador in?
Sure, and he can do that from his computer now too. He's unmuted from our standpoint, but he needs to do it also.
Okay. Hi, everyone. Hello, Francisco. Thanks for the invitation. Long time no see. I'm from professor of epidemiology at the University of Brasilia in Brazil. But 25 years ago, I coordinated a proposal for a new program for controlling animal TB in Brazil. And I was the first program manager, and then I moved back to the academia. But I never ceased to collaborate with the program and do research on TB. But I remember that this was 25 years ago, but when I tried to approach our peers at the Ministry of Health, it was not so easy to talk about TB of animal origin, because apparently people had been trained with the idea that zoonotic TB was not really a major source of TB as a human problem. And another really critical issue was very practical, was that to actually increase surveillance of zoonotic TB, they would have to sort of change the way they do TB surveillance, human TB, to sort of divert more, because they're very much focused on pulmonary TB, and they would have to look for extrapulmonary, non-pulmonary TB. And that would entail, these were the words at the time, and I don't want to say that this is still the case, maybe things have changed, but they thought this would entail this would be a major undertaking. It would entail major changes to the whole routine human TB diagnosis. Well, I'm not sure this is still the case, but what I can tell you is that after having been involved for more than 20 years in TB surveillance surveys and studies in Brazil, all over Brazil, we have quite good data on that, and we know that the prevalence in cattle is higher in more intensive herds and larger herds. But these are probably not the main source of human TB, because these herds produce most of the milk produced in the country. But all this milk will be pasteurized and will go through formal channels. But then when we look at the very small scale herds, I would call them subsistence, that do not sell milk to the market, but they are classified as milk producers. These account for probably less than 10% of the milk produced in the country, maybe around 5-6%. But these account for 40% of farmers. So if you look at prevalence levels, it's actually a low prevalence. Herd level prevalence is quite low, but the etiological fraction of these might not be so low, because these are a lot of farms, right? In a country with more than 2 million farmers, 40% of the milk producers is quite a lot of producers. Even if herd prevalence is low, is still quite a lot of people producing milk for own consumption, and still with some TB present in their herds. And our data also tells us that in these kind of herds, between 60 and 70%, they produce they produce cheese and other milk derivatives for own consumption, or maybe in the neighborhood, something like that, right? So I think when we look at from the animal side, it's like a bipolar situation. You have higher prevalence and a more acute problem on the animal side in more intensive herds, but the zoonotic TB problem might actually be established in the small herds, subsistence herds, with lower prevalence, because they still account for a lot of small herds.
Yes.
Okay, the thing is, and I really don't know how to go about this, it's not so easy, is to actually to deal with this. It's not so easy to deal with this just from the animal side, because that's very much focused on markets and trade and barriers to trade. And this is not the kind of situation that receives really high priority. But if you look at from the human health problem, as a human health problem, and a problem of the extension services, that might be the way to go, right? So it's sorry, I'm not sure I'm being totally clear, but what I wanted to say is that we probably need to look at this problem with different perspectives, because it's not very easy to understand, really, or to make decision makers to understand the problem.
Yes,
Can I say something about that? Can I say something about that? To make it very short, the issue is that we have to have multiple approaches, and I think that this is where the community comes in, because we have to educate these, as you say, the prevalence of all these small farmers, not these people that are dealing with the intensive herds. They're well controlled. It means that we really need to start that activism at that level to highlight the needs of addressing the pasteurization, the heat treatment, etc. So that's the short answer to a very complex question.
And Vitor, thank you very much for bringing the Brazilian situation, which indeed there is very good data. There are very good data in Brazil and colleagues working there. And you highlight the concept that we have very clear, that one size does not fit all. Things need to be very specific for a specific type of herd or communities. So thank you very much, Peter, for your comment. James, there are more people raising hands. Alberto,
yes.
Colorado, I can see. Yeah.
Let's see if we can let Professor Sarman Singh from India. Can we let him in?
Yes, that's fine. Professor Singh?
Go ahead, Dr.
Yeah,
Singh.
thank you very much. Yeah. So I have one comment and maybe one question. The comment is, which I have already mentioned in my chat box, is that in India, I am in the part of the network for many years. I have earlier also in Mexico conference, also I mentioned it. There are many animals. My concern is reverse zoonosis, because in India, when we talk of the eliminate tuberculosis, until otherwise we handle the zoonotic tuberculosis, reverse zoonosis rather, we can never think of eliminating tuberculosis from the humans. Unfortunately, in India, there are a lot of reports with very difficult efforts and writing to many agencies. We could publish very recently one paper from the zoonotic animals, zoonotic tuberculosis from the eco health. I am sure that most of you might have read, or some of you might have even reviewed it, that paper. So in the zoological parks, we found very high prevalence of the Mycobacterium tuberculosis. But we cannot give the details of zoonotic, details of the tuberculosis and the herd and the census of these animal or zoological parks. Number one. Another issue in India is, probably most of you must be knowing, that India is a very God-fearing country. So there are elephants used in the temples. And this early we presented this poster in Mexico conference, but after presenting the poster in the conference, we had lot of communication from the government, and our one of the co-author who collected the samples, he was even threatened that we cannot publish the data. So this data could never be published. Unfortunately, this is a very serious concern, because elephants are used in the temples. They put their uh, uh, a trunk on the head of the people, and kind of thing. So very, and we genotyped, we found very clear clustering and drug resistance, also high drug resistance in these people. So this was actually my comment. The second was question. As I already mentioned, that I am part of this network for many years, but probably we all need to work together. I have never received any call for collaborative project or something like that. Until otherwise, we work together. Probably from the, if we dream to eliminate tuberculosis, this will may not be that easy. So if we are a small group of zoonotic tuberculosis, because otherwise I am a medical person. So I am working on medical tuberculosis for last 30 years, but recently I developed my interest in the zoonotic tuberculosis. Very few people are working on zoonotic tuberculosis. So if I am not receiving any call or any invitation to join any network, I can think that nobody else is receiving any call. So that is my comment. Thank you.
Any comments?
You will receive a direct invitation to join a couple of networks in the next day. But I agree with you, James. Just to remind the speakers to ask their questions as precise as possible, so then we can allow more speakers in the next 5-7 minutes.
Okay, yeah, we just have a few minutes left. Alberto, Colorado, you want to ask a question?
Hello, can you hear me now?
Yes.
Okay, yes, thank you very much. And more than a question, it's just some recommendation from the America's TB Coalition and the Regional Social Observatory of Tuberculosis here in the Americas. And saludos from Oaxaca, Mexico. Unfortunately, a lot of my colleagues are unable to see and watch this webinar because it's in English. So there's a call for the next time if you can include some other languages, please. And from our point of view, we're doing a lot of work in trying to create awareness about the zoonotic tuberculosis or Mycobacterium bovis. But unfortunately, this is still big gaps from animal health and people health in One Health. Even though One Health is like more than 15 years now, it is still very, very difficult to grasp the concept and to put it into single diseases. Even the movements from different movements from the pandemic accords, from the primary health care, universal health care. They try to put everything like a single diseases in one big approach that is hard to do it. And unfortunately, in my area in Latin America, it's the whole thing is about priorities, it's about perspective and cost. So depends on who is looking at the problem. They are saying how much it's going to cost, and that's very difficult for farmers, difficult for patients, and difficult from the governmental view that they are doing just guidelines that cannot be implemented in the field. So this is a call for you and a call for, and thank you, and we welcome this a long time ago when it was released, the roadmap. But it's like this game of how they call ladders and snakes, and so it's very difficult to reach one point that where we can be satisfied. So I would like to at least from the union to think more about how to include the communities, to include the affected communities, because like Francesco says, in our region, we have also several patients who have been affected by zoonotic TB, and the government or the programs are unable to identify, to diagnose those cases, to treat them. And unfortunately, we have also among those people affected by TB. So we would like to have more advocacy, to join advocacy between civil society, governments, parliamentarians, and the huge organization of the union. We would like, of course, funding. You know, the U.S. funding has been making a lot of noises in our communities, and people are suffering for that. But also, it's a sign that we are dependent of one source of money. A lot of the money goes to the international organizations, the Global Fund, and sometimes they don't come out to here, to the region. So it needs to be more fair approach to the funding. And finally, we need more research. We need especially more practical and formal and specific research and what is happening in the area. We know more about bovis in animals, but we don't know more about humans affected by this Mycobacterium. And also it's because we see it from the civil society point of view, it's like M. bovis is not a priority because it's not considered a public health. So if we want to wait for the next pandemic, I think we need to include M. bovis into this vision of human rights and the right to health, dignity, and life for our people. Thank you very much.
No, I appreciate your comments very much. Let's try one more comment from Gazagni Mamo. Do you have a question or a comment for the group?
Thank you for creating this. Can you hear me? Can you hear me? Yeah.
Yes. Yes.
Hello?
Yes, we can.
Go ahead.
Okay. Thank you for creating this opportunity. This is a very important issue. That I am from Ethiopia, from Addis Ababa University College of Veterinary Medicine, and professor of veterinary. I've been working for the last 20 years on mobile TB and the tuberculosis in general in Ethiopia. And as you know, a large number of studies has been done, but still the issue of zoonotic disease is not clearly identified the real impact of the disease. Even though the disease, the bovine TB, is endemic in animals, the prevalence of zoonotic TB is from pulmonary is almost 3%, maximum 3% around that. So this evidence has not created for the public health as to make it as a priority zoonotic disease. So in listing of the priority zoonotic diseases, bovine TB comes, AIDS and the like. So we need to generate evidence, particularly in pastoralist area, in a high because of the nature of their life, and also on extrapulmonary TBs, whereby bovine Mycobacterium bovis has a role. So there is still a need for further integration of the research in showing the significance of zoonotic TB in a country like Ethiopia, where the disease is endemic. So far, there is no control program in the country, even though there are a lot of new information and also even the WOAH new guideline based on the study in Ethiopia. So in relation to the zoonotic TB, it's very important to implement the One Health approach, whereby this issue come up in surveillance and also in the engagement of the different research collaborations. So that's my general comments. Thank you.
Well, thank you very, very much. We're just about having to wrap up. Did Francisco or Paula want to make any comments to these two?
I think that it's important that Liliana Salvador, who's the chair of the Zoonotic TB subsection, and Hind, the vice chair, actually tell us that what we can do as a union. The interest is there, the energy is there. How do we harness that? So I'm going to put Liliana and Hind on the spot.
Thank you, Paula. And before I start, I just would like to give an opportunity to one more of our participants just to make a comment, because by mistake, I lowered his hand. So I feel very bad. So if we could just have a couple, 2 minutes. So for Mustafa Hanafi, can you just quickly let us know your comments about our seminar, and apologies for lowering your hand previously. Yeah, you can unmute now. You will be able to unmute on your side? No? Okay, so apologies for that. So I will just ask you to send us put your comment on the chat, and then we will distribute your comments or questions to all of the participants. And we will also answer all of the questions that were unanswered today. Unfortunately, I think we should have a 2-hour webinar instead of 1 hour. But I just would like to really, because we had so much participation and interest, but I just really would like to highlight that I think that Dr. Zami and we really stand on the shoulders of giants. So visionaries like Dr. Fujiwara and Dr. Francisco Olea-Popelka and many, many others that they showed us today, they really laid the foundation of the field, and they were able to put our field in really high levels, including all of the organizations that launched the roadmap. So, however, and that's why we are here today. However, despite these achievements, and as Dr. Olea-Popelka mentioned, so what? I really feel that, and being part of the union, that the global recognition of the zoonotic TB and also the momentum has faded. However, after attending the last 2 webinars that we organized, actually, now my opinion might be shifting, because we had more than 100 participants in each one of the webinars. But I think that after the pandemic has been really hit the field, and then also current political instability and lack of interest for infectious diseases, but they have showed us that it is possible, if we continue to collaborate across disciplines, that we can actually achieve a purpose. I really would like to just mention that my mentor, Simon Levin, that often reminded us when we were PhD students that we cannot just sit back and hope that others will solve the problem for us. Now that we are aware of the problem, as scientists, we carry the special responsibility not only to the work, but also to bring its message to the world. And I think that that's what we are all doing by being here and continue to work in this really important field. So both of our speakers mentioned the framework and moving forward using the AAA framework, awareness, acceptance, and action. We started to just gain the momentum to start by renewing this awareness of zoonotic TB and how important it is. So our goal at the moment at the Union, it is to really rebuild our network, not from the top to the bottom, but now from the ground up. Like Alberto Colorado mentioned, it is really like empowering the communities that are most affected to lead the way, and with our support as much as we can. So we will just let you know what our plans for the next few months. So in the next few months, we will be hosting speakers all from across the world to highlight local realities. So we know that each region will have their local challenges. And so we really would like to highlight those, the economic, the cultural, the medical, and to learn from those that are living this crisis daily. That's why we invited the zoonotic TB survivors as our first webinar. We will also organize local symposiums in local languages, not only in English, to ensure that there is inclusion beyond the English-speaking world and also in different time zones, not only the one that suits us the best. We also would like to engage students. I sent this webinar invitation to all of the students, undergraduate students, graduate students that could be potentially interested in this topic, because as I learned when I was little to recycle in kindergarten, I think that if they start learning from early on that zoonotic TB matters, they will really make a change and they will be the new leaders of the world. And so we will learn with this, and this will be awareness, and then we will reach our second step, which is acceptance of the challenges at the local level. So we will continue working with local public health units, engaging with global health agencies that have already been in the past, and continue advocating on how animal zoonotic TB matter, and it is important to control them. And also, I know that it is global cooperation at the moment is really difficult, but I just really would like to continue and ask you all to be optimistic and then just continue to think that we can do this together. And so if you have any ideas and solutions how to really act, how to go from here to really make a difference, please reach out. Let's spread the word, strengthen our network, and work together. And I really think that it will be possible, and I hope I'm not being too optimistic, that we can create an effective but also resilient, because any system that will function has to be resilient, and it will always bounce back, a surveillance system to end zoonotic TB. And so with that, I really will finish. I will be very happy to answer any questions by email later on. And I thank you, all of the participants and our amazing speakers, for being here today, and our moderator, Jim Sundstrom, and Tyler for helping us to organize this through the union. Thank you very much.
Thank you, everyone. And that will conclude our webinar for today. We'll hopefully you could join us in November for the ZTB section, and then in January we'll resume these union webinars, and hopefully we'll have even more people. Thank you.
Think globally, act locally.
And the webinar will be sent, the recording will be sent to everyone that has registered. Thank you.